Okay, welcome everyone. I'm Alex Helfand, Education Coordinator for the Salty Dogs. And tonight's webinar is about medical emergencies and um, managing medical issues at sea. And I would add, not just for the purposes of the passage, but once you're down in the Caribbean, things happen. And the services that the presenters tonight offer and the information they can give is really valuable and can make your sailing season down south a lot safer and a lot more pleasant. So tonight we have two of our Salty Dog sponsors with us, Duration Health and GW MMA. And presenting for for Duration Health is um, Dr. Therese Malka, and I'm going to actually hand over to Dr. Malka, and she'll start her presentation. And then later on, I believe, I think it's Dr. Adam Rudenberg. He's going to be presenting for GW MMA. As we've done in the past, please put all your questions into the chat. And at the end of each section, we'll answer those questions relevant to what we just talked about. And then any other questions that you have at the end, we will make sure we get to, so nothing will get left behind. And with that, I'll turn it over to you.
Okay, great. Can everyone see the slides?
Yeah, it's great.
Wonderful. So I'm Therese Malka. I'm one of the physicians for Duration Health, and I'm an emergency physician pediatrician. And I volunteer with Lindblad and National Geographic expeditions. So I spend a few weeks a year out on a boat on the water. And what I'm going to do is just go through the most common conditions that you're going to encounter out on the sea or on the water, which I'm sure you're all familiar with, and just go through a little bit of management and then end with some suggestions for what you should bring with you in your first aid kit and medical supply. All right. Number one is strains, sprains, cuts, and
Right.
bruises.
This is all about medical kits for passage, like medical.
Yes, so Duration provides prescription medications packaged in a kit, and this presentation is going to be about some general medical care and then move into medical kit suggestions. Right, so bumping along, I was going to start with wound care, which was a question that was passed along to me. And some mistakes I see are using antiseptics, hydrogen peroxide, alcohol for wound cleaning. And actually, your best bet is going to be a large volume of water under pressure. So a hose, a shower, a plastic bag with a corner cut off, or a syringe. The more water you can get in there to rinse out any seawater, any dirt, any salt, any contaminants, and any bacteria is going to do way more than any medication or antibiotic for preventing infection. So in the ER, we'll often hold a wound under just running tap water for a full 60 seconds. And that's been shown to remove as much bacteria as you can. And so I would try to approximate that as you can. If you have a lot of bleeding once you've got the wound clean, almost all bleeding you're going to be able to control with firm pressure. And a mistake that's often made there is putting pressure on for 2 minutes or 5 minutes, and then you check it and it's still bleeding. So you're squishing, releasing, squishing, releasing. Just put pressure on it with a hand or a bandage for a good 20 to 30 minutes before you check. And that's often all that you need. In terms of wound healing, there's pretty good data that keeping a wound moist is actually helpful, though you want to avoid seawater and dirty water, a layer of Aquaphor or Vaseline or an antibiotic ointment, and then keeping it covered just helps keep that clean, healthy, and skin and healthy and clean and keeps bacteria out. You don't never need to start antibiotics for a cut until you see signs of infection like redness or pain or pus or an odor. And then at that point, you would certainly want to start an antibiotic if you're not able to get back to shore. And some seawater has a specific bacteria that needs an antibiotic called a quinolone, like ciprofloxacin or levofloxacin. So if you're going on a long trip and thinking about bringing prescription medications and you're in salt water, that's a good medication to bring with you. We had a question sent to me by email about head injuries and concussion management. And I think the biggest question with that is going to be someone slips and falls and hits their head. Do we need to end our trip and emergently get back to a hospital, or can we kind of watch this on the boat? So I think of it in terms of symptoms that don't trouble me too much and then scary symptoms. So automatic, please get to shore, get a CAT scan, see a provider, would be any prolonged loss of consciousness. So if they're out for 10, 15, 20 minutes or not coming back to normal, that's your sign to head into shore. If they have a seizure or twitching or any abnormal body movements, a really severe headache that you can't get on top of, if they seem really sleepy, not waking up for you right, repeated vomiting, or just seem completely unlike themselves, those are all going to be automatic evacuate, get to healthcare. Then you have this middle ground where it would be great if you could get back to shore, but maybe if you only have one of these symptoms and they're doing okay, you could cautiously watch it on the boat. So that would be a brief loss of consciousness, like they just seem stunned or out of it for a few seconds and then come back to normal. It's not great, but it's not as troubling as a prolonged loss of consciousness. If they're a little bit confused or repetitive or don't remember exactly what happened, if that's the only symptom, you may be able to watch that a little bit. One episode of vomiting can give a pass and see how they do. And just a medium headache, you can probably watch. And then all those bottom symptoms are very classic concussion symptoms and not necessarily scary if you don't have some of those red flags. And that's someone you could maybe watch on board, continue your journey. We no longer recommend waking up sleeping people. If you have a concussion, you actually want to get plenty of sleep and rest. It'll make your head feel better. And if you can't evacuate or get to shore and someone is getting worse during the night while they're asleep, there's nothing you can do about it if you wake them up and they're getting worse. So really, if you've made the decision to stay out at sea, wake ups aren't going to do anything except cause discomfort to the patient. But if you have a red flag patient and you're heading back to shore and they get sleepy, you may want to wake them up every little bit and see how they're doing. Cool. We got a question about splints, and the little acronym we like to use out in the field is to make your splint buff, which is big, ugly, flat, and fluffy. So I actually dislike a lot of these splints. They'll work for you if you're immediately going back to shore, going in a car ride, going to the hospital. But over time, that magazine, that orange Sam splint that you see in the upper left, which is a commercial product you can buy, those are going to start to rub and chafe and really break the skin down over any bones. So that splint on the right is much better, where all the bony areas are padded up with clothing or towels or whatever you have. And that's going to prevent blisters and skin opening and just be way, way, way more comfortable. And that fluffiness, as you cinch it down with a rope, actually helps to provide more support to whatever might be broken or injured. So just make your splints really big and fluffy, and that's going to be super comfortable for the person and give it a lot more support and protect it from further injury. Moving on to the next most common condition that you're going to encounter is seasickness, and you've got a ton of treatment and prevention options, lots of good over-the-counter options. You've got multiple types of Dramamine. Ginger as tea or as candies can be really helpful. Actually, smelling just plain rubbing alcohol, so those little alcohol wipes, can really reduce nausea. And the C-bands or acupressure bands that push on the spot on your wrist, some people find helpful. And then you've got some good prescription options, scopolamine patches that you can wear behind your ear for about 72 hours, and ondansetron, which comes in a dissolvable tablet that you can melt in your mouth if you're having nausea despite some of the other measures. The only caveat in scopolamine is it makes some people dizzy or sleepy, so I always recommend a trial before you use it on a boat for the first time. But what do you do if someone does get dehydrated? If they can keep in some food, just eating your regular diet with some extra fluids is going to be ideal because you'll get some good electrolytes and glucose from your diet. But if you're not able to eat food, then you really need to make sure whatever liquid you're drinking has some sugar in it and has electrolytes in it. Pedialyte's fine. Most sports drinks are fine. And if you don't have those and you need to make it, there's a little recipe on the bottom where you can put a little bit of salt, a little bit of sugar into some water. And then to get potassium in there, you could add a little orange juice or a banana. Sunburn, I think, is really obviously a risk when you're out on the water. And once you're sunburned, you have a really hard time maintaining your body temperature and maintaining hydration. So best to prevent that as much as you can. Cold and heat related illnesses are both pretty common out on boats with exposure, probably cold more of a concern than heat is. So just making sure that you have proper raincoats, warm layers, the right clothing for the situation. Eye irritation and infections are really common. You're getting splashed with water and wind. So probably bringing some eye care items in your kit are going to be really helpful. Allergy eye drops can really help with just irritation, any redness or itching from getting salt water in it all the time. Natural tears, I especially like the one that's more like an ointment, can just soothe and protect your eye from some of that rain, wind, seawater. Antihistamines can help with itching and redness, so bringing some Zyrtec or Claritin. And then prescription antibiotic drops and antibiotic ointment are probably not a bad idea to have with you, given how common eye irritation is. On the same idea, getting swimmer's ear or an outer ear infection is not uncommon with how much wind and water is going in and out of your ears. So if you're prone to that, having earplugs or some swimmer's ear over-the-counter drops to help dry out your ears are awesome. And then one of the things we provide is an antibiotic and anti-inflammatory ear drop, which is another good thing to bring if you know that you're prone to this. The next most common thing to happen on boats is chronic conditions get worse. They did a study of people with asthma and found that 40% of them had the worst asthma attack of their whole life while traveling. So you can expect almost all chronic conditions might get worse when you're out of your element, moving around in different climates. So remembering to bring whatever you need with you to potentially manage those chronic conditions. And I'll talk about that a little more in the specific medications, but bring a little extra of your medications. And if you know you have asthma, diabetes, something that might act up, make sure you have the medications you need to cope with that. So that brings us into first aid kit suggestions. This first is all your over-the-counter stuff, and I think it's pretty self-explanatory, but one that I like to point out that sometimes is forgotten is bringing some packets of an oral rehydration solution powder. That can be really nice to have for seasickness or if anyone gets a tummy bug while they're out there. And then aspirin, although we hope this doesn't happen, you're never going to know if chest pain that occurs while you're out on the water is a heart attack or not without medical equipment. So anyone with chest pain, you can safely give aspirin. And if they are having a heart attack, that can be life-saving or save heart tissue. So aspirin is one to keep in your kit, even if it's not what you would reach for pain. Typically, that's great for an emergency situation. And then some prescription medications that are very specific. And these are all things that we are able to prescribe in a little pack like you see. So those motion sickness patches that I described earlier, ondansetron for nausea, several antibiotics specifically for the cuts and scrapes that could potentially get infected, but also for ear infections and eye infections, or you can always pick up a respiratory or gastrointestinal infection while you're out there. Cyclobenzaprine is just a muscle relaxant, but sore muscles, throwing your back out, sprains are pretty common. Diclofenac gel is just an anti-inflammatory gel that you can use for sprains. And then we talked about the eye and ear drops. An oral steroid is most likely to be used if you have asthma or respiratory issues like wheezing, but can also be used for severe allergic reactions and rashes. And then an EpiPen, it's probably not necessary if no one on your boat has known food allergies or severe allergies, but if anyone does, there's no substitute for it and it's life-saving. And if you're going on a long trip specifically, that's a really important one to have. And then if anyone has asthma or a wheezing history, an albuterol inhaler is going to be really helpful. And lastly, specific medical equipment. An AED or a defibrillator will check your heart rhythm for you and tell you if you need to be shocked if you do happen to be in a situation where someone has a cardiac arrest. So it both helps with diagnosis and can give the shock if it's needed and guide you through CPR. You obviously hope you're never in this situation, but there's no substitute for this if you need it, and it can be life-saving. So if you're going with big groups, with people who have underlying medical conditions or heart conditions or long trips, this is a really great thing to have with you. Splinting supplies, so you're ready for that. Maybe some way to check vital signs like a blood pressure cuff or a pulse oximeter, thermometer. Urinary tract infection dipsticks, that's a difficult one sometimes to diagnose when you're out on the water. That can also check for diabetes emergencies by checking for sugar and ketones in your urine. Pregnancy tests is really important if you're traveling with women. That can help you figure out if you need to evacuate, because abdominal pain may be okay if you're not pregnant, but is an emergency if you are. Menstrual supplies if you have people with uteruses with you, and then trauma supplies in addition to the medications we discussed. And that said, I'll pass it over to Dr. Jack to tell you just a little bit more about Duration Health, and then we can answer some questions.
Thanks, Dr. Malka. Thanks for the great presentation. Very briefly, my name is Benjamin Jack. I'm also an emergency room physician, founder and CEO of Duration Health. The service that we provide is these prescription medical kits for off-grid travel for people like the people in this room who are traveling to places where you wouldn't be able to access routine medical care. So the way that it works is you come to our website, you sign up, you do a video call with one of our physicians, Dr. Malka, or another one of our doctors, all of whom have training in wilderness medicine. Then we actually prescribe you those medications that Dr. Malka was talking through. We package it all up into an orange bag and we ship it to you. You bring it with you. That way, if you do get sick, you already have access to everything that you might need. And on our formulary are all the medications that Dr. Malka described. We do also have defibrillators. That's a very expensive piece of medical equipment, but she makes an excellent point that if you're traveling with a big group or on an extended journey, something else you might consider. But for most people, our marine medical kit is a great option. And we actually have a sponsorship with SDSA where you can use the code SDSA23. That SDSA23 and get $50 off the marine medical kit. So we'll put that in the chat. So thanks for the information, Dr. Malka. Thanks for having us, Alex. And I think I will turn this over now to Dr. Adam Rutenberg, who's going to be talking to you about GWMMA.
Before you do that,
oh, okay.
There were a couple of questions that popped up. Just got to find the chat box. Here it is. That are sort of relevant to this section. So I guess I had the first question. When we were talking about not using some of the antibiotic, I guess, wipes and things, how about using HIPAA-cleanse, antimicrobial, that antiseptic soap? Is that something you do use, don't use? What's your feeling about that?
It's not necessary, especially for initial wound cleaning. Immediately, what you want to do is just get all the gross stuff out, and really it's just pressurized volumes of water that does that. But as the wound is healing over time, having an antimicrobial soap in the shower to do your wounds cleaning with so that new bacteria aren't accumulating on it is fine. But really just regular soap and water with volume of water should do well. So I don't dislike it, but it's not something that if you're tight on space, you have to prioritize. It's certainly going to be less damaging to your skin than hydrogen peroxide or alcohol.
Okay. And then there's another question about the scopolamine patch. One person thought they weren't available. Is that true? Not true?
There was a shortage for a while, but recently they've been available. Some providers don't like them because of the side effects like sleepiness, and they can make some people irritable, but they are available.
Okay. And then the last question, so you mentioned the UTI test. There are
Yeah.
some test strips that are used just for infections, or do the same ones also measure other things?
Yeah. So all UTI test strips measure a whole bunch of things. They measure white blood cells, which are present in infection. But that can be either a vaginal infection or a urinary tract infection. So the person who's sick would have to know their symptoms a little bit to interpret that. And they can be a little inaccurate if you don't get a clean sample, but they're relatively accurate. They check for something called nitrites, which is almost only positive in a urinary tract infection. They check for ketones and how dilute your urine is. So those are markers of dehydration or diabetes emergency. And they check for sugar spilling into your urine, which is also a sign that your blood sugar is high. So if you have diabetes, you know how to interpret that. But using them to diagnose a urinary tract infection, you'd be looking for the leukocytes and the nitrites. And if either of those is positive, that's pretty accurate and diagnostic for a urinary tract infection.
And then in that case, there'd be one or two meds in the kit that would be relevant.
Yeah, in fact, almost all the antibiotics we use are actually decent urinary tract infection coverage. And we always ship our kits with a little field guide that tells you which antibiotic to go for if you're not able to get telemedicine in real time.
Okay. And then the last question is, can we get a copy of your slides? If you can send them
Absolutely.
to me, then I'll make them available to everybody.
Yeah, no
Okay.
problem. I will do that now.
Any other questions at this point we have one more. For seasickness prone crew, when should scopolamine be started?
Oh, great question. You do actually want to start it before you get on the boat. So you already want it to be in your system starting to work. I usually tell people to just put it on the day before they're embarking, but if you get it on there probably 3 to 6 hours before you go, it should be starting to release and working.
Okay. Any other questions for Dr. Malka and Duration Health at this point? If not, then we're gonna turn the floor over to Dr. Adam Rutenberg. And we'll hear.
Thank you.
Okay.
All right, let me share my screen here. Before I do, I want to say I think that last question about urine dipsticks actually was really a great segue into what I'm going to talk about a little bit. So, I think it's very important to think about what resources you have available to you on board, and medications and equipment are one of those resources. But, knowledge and reach back to shore for some expert opinion is, another important resource. And that's where we come in. So let me just see if I can share my screen so I can get this presentation up. All right, does everyone see a window there? It says GW Maritime Medical Access. Okay, great.
You're good.
So I'm just going to start with a brief introduction of myself. So my name's Adam Rutenberg. I'm an emergency physician at George Washington University. I do clinical time in the emergency departments at George Washington University Hospital, which is a level 1 trauma center here in DC, and also at the Veterans Administration Medical Center in Washington, D.C. Our practice staffs that emergency department. And then I've also for many years been doing telemedicine, both maritime telemedicine and telemedicine in other remote, land-based locations, and also aircraft-based telemedicine. So when people have emergencies on board private aircraft, that's something that we cover here. I'm the quality improvement director of our maritime medicine program at George Washington University, which is called GW Maritime Medical Access. I'll tell you a little bit more about that. And then the other thing is I'm a tall ship sailor myself. Been, started sailing Sunfish when I was 5 years old, and have, sailed on a variety of boats. And I don't get to do this that much actually now with a busy career and young kids, but this is me in the blue here up on the yard on the Kalmar Nickel, which is the state tall ship of Delaware. So one of the things that I think we pride ourselves on at GW is that most of our doctors are sailors, or we're in the Coast Guard, or otherwise are in some capacity have experience, so that if you call us and you start talking about a mechanism of injury or something that's going on, we understand what kind of an environment you're in, what kind of injuries can be seen, what kind of illnesses can be seen, and hopefully can speak some of the same language. So that brings me to who are we? So George Washington Maritime Medical Access is a program that lives within the Department of Emergency Medicine at GW. It's actually been around since 1989, which is well before I was here, well before I was even a physician. And we provide 24/7, 365 medical advice to vessels, aircraft, and remote locations around the world. We run a 24/7 call center that's available to our clients at any hour of the day through a variety of communication modes. So, satellite, email, telephone, dedicated telemedicine kits, et cetera, to put people who might be experiencing a medical emergency or not experiencing a medical emergency, but just have a question or a need, to put them directly in touch with a subset of our emergency physicians. We work across the maritime industry. So we work, we cover shipping vessels, fishing boats, research vessels. We've branched into business aviation, cruise lines, recreational boats, regattas, rallies, races. And then we've also got, some government contracts and other remote locations. We provide medical, chiefly medical, but also some logistical and operational support. And let me talk a little about that. So I want to start sort of at the 10,000 foot level and say that the most important thing you can do before you go on a voyage is prepare for your voyage. And that really starts with seeing your own doctor. So it's fantastic if you have medications aboard. It's fantastic if you have the ability to reach back to a physician ashore. But, we find, unfortunately, time and time again, if you have a chronic medical problem, as Dr. Malka was saying, these tend to be exacerbated ashore, when you're offshore. And it's very important to go and talk to your doctor before you go to sea. Now, not every doctor might really fully understand what it is that you're going to be doing and where it is that you're going to be, or the environment that you might be in. So it's really important to talk to your doctor about these things specifically. So, there's a huge difference between spending a day on the Chesapeake Bay, versus doing a transatlantic crossing. And so to talk with your doctor about the nature of your voyage. Get a complete physical, get lab work, make sure you're up to date on all of your vaccines. And that's particularly important if you're going to be traveling to areas of the world where specific diseases are endemic and specific vaccines are recommended. Make sure to get an EKG, and then have your doctor do a medication reconciliation and provide refills for your medications. And make sure if you have chronic medical condition that's dependent on a specific medication, that you have enough of that medication with you to last you through your voyage and then through any potential anticipated delays. And then it's usually a good idea to even add a little bit more on top of that. And then the other thing is that we always recommend that people get that rash or lump or other nagging issue checked out. So, if you think you're maybe having a little shortness of breath when you get to the top of the stairs, people on shore, they don't necessarily want to make an appointment. They don't think it's a big deal. They think they have all the time to do that. But then, once you're offshore and you start having a problem, you don't want to be in that situation. So getting checked out and making sure that you've addressed anything and everything and that you're well prepared to go to sea is very important. And in some cases that, may mean something that nobody ever wants to hear, which is, your doctor telling you this might not be the best idea for you, or yes, this is something you can do, but let's talk about what kind of accommodations you should have and what you should anticipate when you're offshore. So that in preparation for the voyage, the captain on board should make sure that they have a good medical summary for each crew member. Now, this doesn't necessarily have to be something that's wide open that everyone talks about, but it's very important that everybody knows where to find everybody else's medical information when you're on board. And it could be the skipper who gets sick. So, it could be the mate. It could be the person who's trained as a doctor, who has had a career as a doctor who's on board. So everyone should know where to find this information. You can put it in a sealed envelope, and if you have a problem, you can open it if needed. So keep it confidential. You want to keep, ideally a single sheet summary that's laminated in a sealed envelope with all of the pertinent information that might be needed in a medical emergency. So someone's name, date of birth, list of doctors, including phone numbers, what medical problems they have, what prior surgeries or other medical procedures they've had, what medication lists they've had, what allergies they might have, and in particular, allergies to medications. That's very important. And keep a copy of that EKG too. I mean, there are times where somebody might be in a foreign port and get an EKG, and it's reviewed, and something might be seen on it that could be problematic or might not be problematic, depending on how long it's been there and what the particulars are of the situation. So, copy of the EKG. Now, people ask, can I keep this digitally? Can I put it in an email? Can I just have it, in my Google Docs and access it or find it when I need it? And I think, the short answer to that is sure, you certainly can. But that doesn't take the place of having a good, solid paper copy that's not going to fail, ideally. In the case, of course, paper can fail too, but you don't want to be subject to technology failures when you need important information. So then the other important point is, do you have a shoreside connection? And this used to say, do you have a satellite phone? But today, with the proliferation of satellite internet, things like Starlink, which have really become much more readily available throughout the world, there's a lot more bandwidth available when you're at sea than ever before. For a long time, it was satellite phones, and before that, radio. But if you do have a shoreside connection, make sure that you know how to use it. Make sure that everyone on the boat knows how to use it. Subscriptions are up to date, that you have backups potentially. If it has a connection to a medical kit, make sure that people know how to use that. And then, equipment is one resource on board, but knowledge is another resource on board, and it's an important resource to have. So depending on the circumstance, sometimes a book might be adequate. Maybe there's a physician on board, although, keep in mind that somebody who trained, let's say, as an anesthesiologist or a cardiologist might be able to provide excellent care and excellent information in a specific scenario, but that doesn't, that might not cross the entire depth and breadth of the kinds of emergencies that might be seen. And that's where a generalist like an emergency physician can really come in handy, and in particular, a shoreside emergency physician who's able then to subsequently reach back to specialties if necessary. One way to get a little bit more information or a little bit more of that resource on board is to consider taking a course. So, we always think about safety courses, survival courses, firefighting courses, and first aid courses are very important. And I have this on here, how many people beside yourself took a course? Because if you have, 3 people on a boat and only one of them knows how to use the communications equipment, or only one of them knows how to provide first aid, and that person winds up a victim, then you can find yourself in a very dangerous situation. Are you bringing medications or medical equipment? So this is just sort of a little bit of a connection to what Dr. Malka was talking about. It's important, if you bring medications, to know the expiration dates, make sure you know how much you have, that they are kept in waterproof containers, and that they've been inspected recently. So you want to make sure that everything that you have is up to date and in good condition. And I mentioned batteries here, but there's other medical equipment that you want to keep with all of your equipment. So in particular here, if you have equipment like a blood pressure cuff or a pulse oximeter, you want to make sure that not only is it in good working condition, but you have backup batteries in case you have a problem, in case you, to avoid dead batteries. So telemedicine. So this is one of my colleagues, Dr. Sika here. He's actually working in the ER, and you can see the bank of phones that we have on the wall. So what is telemedicine? There are a lot of definitions for telemedicine, but the way I like to think about this is that it's remote medical consultation. It is the ability to get knowledge and experience on the phone that allows you to, or that allows you to make a diagnosis and a treatment plan that you might not otherwise be able to make. Where is telemedicine available? Anywhere you are. So at this point, we can connect with people anywhere in the world. And why? And as I said, it's because it brings assistance to you. How? So I'm going to put our phone number here. there are obviously I'm fond of our service. I mean, there are other groups, but we're going to work to bring a discount to your group for this coming sailing season. And this number that I have up here, 202-715-3421, is an office number. It's a non-emergency number for you to call if you'd like to discuss with my colleague on the call, Alex Cullen, about some of the additional services that we offer. And then as I said, we're all board certified emergency physicians with experience in maritime aviation and austere medicine. When do you call? When would you want people? When would we want you to call us, or when do you think you should call someone? So, the question is, when is someone sick enough? And I think, there's really no right or wrong answer to this, but the way I like to think about it is, does something make you nervous? Does it impact your mission? If you're sailing around, if you're offshore and there are only 2 people on the boat, a very minor medical problem can be a major hit to operations. Even if just somebody has, knee pain, or maybe a UTI, or they have the flu and they're really under the weather, that makes a lot more work for the person sailing, but it also puts extra responsibility on the person sailing, the healthy person, to not only take care of that boat, but also to take care of the individual who's sick. And that's true whether there are 3, 4, 5 people on a boat. As soon as you go one person down, you have a lot more cognitive load to manage and a lot more tasks to manage. So something that impacts the mission. Call early, call often, no issue is too small. We always would prefer that we get a call for a minor cut. As Dr. Malka said, we don't always start antibiotics, but the way we work, and I'll talk about this in a minute, is that we're not a one and done service. So we might get a call for a cut on the foot. We might talk a little bit about first aid and the appropriate way to manage it. And then we'll call back the next day, or 36 hours later, and then 36 hours later. And so we will find signs of infection early and be able to intervene early. And we always want to intervene early before a minor problem becomes a major issue. And so that's why I say, if anyone works with us, we always encourage them to call whenever they need us, and we set up a follow-up communication schedule so that we can reach back out to them and make sure that things are going well. This is just a little bit about how we work. Most telemedicine companies will probably work similarly. Consultation starts with the communication center. A physician will typically join, or it can come in via email and a physician will respond. We gather extra information, and we think of this the same way we would think of a shoreside visit in an emergency department. All of our physicians, like me today, I worked in the emergency department, and then tomorrow I'll be on maritime call. And so we think of it the same way we think of a live in-person visit, where we collect extra information, we make a treatment plan, we understand the resources that are on board, we review the plan with the client, and then we follow up, and then we close the case when the case resolves. If for some reason we need extra assistance from one of our colleagues in a different medical specialty, we have specialists that we can sub-consult with. If we think that somebody might need to be evacuated, we can help make that decision. We always bring 2 physicians at least on the line so that everyone understands what the implications are of a diversion. And we can provide case management as well for people who are admitted to a hospital abroad. When you call, so this is whether you call us, whether you call your own physician. And I will say that sometimes people think, they can just call their own doctor. And in some cases, that might be fine if a doctor is willing to do a telemedicine visit at sea. But some of the things that we'll need to know, the vessel name, the location, the time to port, the expected next port. We're going to want to get identifying information. And then this is where we come back to that medical history that I talked about. The time when somebody is ill, or maybe has altered mental status, or can't necessarily tell you what their history is, that's not the time to try to figure out what their medical history is. We're going to want to get a set of vital signs, so it's important for you to have that equipment on board and know how to use it and be able to collect pulse, temperature, blood pressure. We're going to want to know what happened. And then we're going to want somebody on board who's going to be prepared to answer questions and potentially do a physical exam under our guidance and relate findings to us. I will tell just a brief side story. I had a case not that long ago where somebody was having shortness of breath, and of course they were on a large cargo ship, no X-ray. And I asked the medical officer, who was a professional mariner, she's a chief mate, to listen to the lungs. And I kind of talked her through what we're actually looking to hear. And I think that the email that she sent me back may have been a better presentation of lung sounds than I have ever gotten from any resident that I've ever been training. So, it's very possible for people out there, even with very little experience, with the right kind of discussion, to provide really relevant physical exam findings that can help us to make recommendations about what medicines that you've got on board can be used. Be prepared to send us pictures if you have that kind of bandwidth. And then again, as I keep kind of driving home, know your onboard equipment and medical training. So in conclusion, be prepared, prepare the individuals on the boat, prepare the boat itself, communicate early, communicate often, and thank you. And I'll also be happy to take any questions.
Okay, thank you very much. So far, we'd love to get your slides as well. And I think, whoops, I just lost the questions there. And I think Alex said there'd be no problem with that. So there was a question about private insurance. Yeah,
so we don't accept private insurance, but we also don't work on a fee-for-service basis, which actually I think in many ways makes us very much more affordable. So we typically will charge just a low monthly rate, and that provides unlimited consultation with us.
Right. I'm just going to add that we will publish in the next couple of days what the opportunities are with both Duration Health and GWMMA in terms of the services that are being offered to Salty Dogs for this year. So those details will be there. And since there's no other questions, I'm just going to add a personal comment. We used the service last year, and very much the way Dr. Rutenberg described, we sent an email describing a condition that one of us had on the boat, and I got a reply back very, very quickly, and we had communications that day. We took some actions. There was follow-up. I think the bottom line with these kinds of services, it was really great peace of mind. We've used it down in the Caribbean. I think we actually used it up north during the summer. So it's been a very it's very settling to know that you've got people behind you. And I think the other thing that we've been talking about offline was that in the event of, particularly when there's only two of you on the boat, if one of you is incapacitated and the other person is caring for you and trying to get the boat back, I think the services can help. I think maybe make things a little bit easier when you get to shore, because you can't be spending your time on the phone trying to figure out who's going to be there when you get to the dock while you're trying to get to the boat to the dock.
Yeah, and I will add to that one of the things that we will do is help to communicate. So if you're going into port, and we need to, we actually never initiate communication with the Coast Guard unless requested. We know that that's ultimately up to the skipper. We might make a recommendation, but once that happens, if there needs to be a call ahead to an emergency department on shore, we can do that to let people know someone's coming in. And ultimately, the Coast Guard will make final recommendations or final decisions about any evacuation. But we have been, in many cases, asked to communicate with the U.S. Coast Guard or Coast Guards around the world, to sort of give them a report about the situation on board and provide, take some of that communication need off of the skipper in those situations.
Yeah, I'll add that, we have our shoreside coordinator team that in the event during our passage down to the Bahamas or the Caribbean, if something happens, we're typically talking with them, and they've often coordinated with the Coast Guard, but the services that both groups are offering will cover you the entire season. And shoreside coordinator isn't there once you're in Antigua or once you're in the Bahamas. And that's when you really need this kind of assistance. So I'm just trying to set the stage and clarify the kind of the extent to which this can help, particularly, and this is just a thought for those people on the call and who maybe listen to this. If you look at the age of a lot of our cruisers, we're on the older side. We don't want to think we're old, but we are. Stuff happens, and we're also tending to sail shorthanded. So this all kind of, I think, helps mitigate some of the risks associated with both of those. Does anyone have any other questions? Oh, you're all very quiet tonight, guys. Okay, well, I'd like to really thank both teams from Duration Health and GWMMA. This stuff has been really useful. There will be another, for those of you in Hampton, we are going to have a hands-on session covering emergency medicine. I believe that's Saturday. So there's another opportunity to learn more. And as I said, we'll post this information. Yeah, it's on the 28th. We'll post information on how to get access to both services on the website in the next day or two. So thanks, everyone, and have a great night. I'm going to stop the recording now. One last question. Any other questions? Just one last chance. Okay. Great. Have a good night.
Take care.